I'm Dr. Regan Tilley with Whole Health MHK in Manhattan, Kansas, and I'm going to be presenting on Biote, bioidentical hormone replacement therapy. I want to thank all of those who are here with me tonight for joining us, and I am ready to get started with the session. So we're going to have this live and then have it on the website for people to watch in the future. So Biote, bioidentical hormones. People are going to ask, why do we need it? What are hormones? Why are they important? What is hormonal imbalance? We're going to answer some of these questions as we go. Are you able to advance the thing?
Mm-hmm.
Okay. Maybe. We're a little technical management here. So, all right.
Your head's in it.
Your head's in it. So, yeah. Okay. Slide the computer towards. All right. So, when you give a lecture, they always tell you to tell the people what you're going to tell them what it is, and then at the end we'll tell you what we told you. So these are the things that we're going to talk about: what you need to know, who can and who should you believe, and what can you potentially do to help your hormone balance. So hormones, they're the little chemical messengers that are made by our endocrine glands, which include thyroid, adrenals, your gonads, so ovaries and testes, and are used to activate and create change in our cells. They work in a lock and key fashion. We can use Premarin and artificial hormones because the key looks very similar, but it's not exactly the same. So then we have some problems. So this is kind of picking the lock with something that's similar. So we'll get into the differences in the future, or a little bit later here. And then there's this question, do we age because we lose our hormones, or do we lose our hormones because we age? Traditional medicine says that we lose our hormones as we age. It's normal and it's supposed to happen, and it is what it is, and you can't do any different. Go ahead and advance. So I'd like to be able to give you the examples of how you can optimize your life so that you don't feel like this, tired, bedraggled, exhausted every day. I'd like everyone to be able to age and to feel rejuvenated and excited and not dealing with mind fog or low libido or just kind of a lackluster approach to life. And I see a lot of patients coming through my door feeling that way. And again, what we saw in those last few slides was a variety of ages. So hormone replacement therapy is, again, traditionally been considered to be used for men when they're old and getting a little hunchback and they have no testosterone left, or women who've gone through menopause and are dealing with severe symptoms and hot flashes. So these are the symptoms that we often find lead us to kind of dig into hormones. So extreme fatigue. You hit the wall in the evening, you need to eat a big snack or drink a lot of caffeine or have sugar to keep going, to get home, to make dinner, to go to bed. Mood swings, anxiety, tension and irritability, trouble sleeping, especially with those middle of the night or early morning wake-ups, memory loss, depression, focus issues, night sweats, weight gain, joint pain. The list goes on and on. So big ones that we have women and men both complain of are joint pain, headaches, decreased sex drive, memory loss, and mood changes. So with the Biote method, we want to balance things. So we don't just look at one. We look at testosterone, we look at estrogen, we look at thyroid. We also use specific supplements that are from a very high quality vendor. If you've heard of Thorne Pharmaceuticals, that's who provides the supplements that we utilize to give us the best quality, most consistent quality products that we can use to get the balance of the things that we need to make the hormones work best. And those are cofactor vitamins like vitamin D, vitamin K, iodine if you have thyroid issues. We work with methylated B vitamins. So, and there's several other supplements that can help us depending on where you're at on your path. So andropause is male menopause or menopause. It says 38% of males over 45 years of age have low testosterone. It's common in men with diabetes, high blood pressure, sleep apnea, other chronic disease, and obesity. They didn't write that on here, but obesity is a huge risk factor for early andropause or menopause symptoms. It's linked to early heart disease, and it's often underdiagnosed because what happens is the guy will come in and he's like, Doc, I just, I don't have my spark anymore. I need a little help. Okay, here's some Viagra, or you need an antidepressant. But it does not treat the root cause. And that's what we are working on doing, is treating the root cause. So some facts about testosterone. We often have been told that the testosterone is the blue hormone. It's the men's hormone, only the guys need it, blah, blah, blah. Well, it's in both women and men. Women have a much lower amount, and most of their testosterone is created in their adrenal glands, not their ovaries, whereas men have a much higher testosterone. But healthy young women should have high testosterone. They should have adequate testosterone. That's what keeps them, vigorous and youthful. They talk about how much is lost per year in men between the ages of 30 and 70, and that's 1 to 3% loss in production per year. And women between 20 and 40 can lose up to 50% per year. And that's a dramatic change for women. And it's often when we start feeling those symptoms in mid-age. So this slide can be a little confusing unless you really pay attention to it. So what I want to give you reference to. So the ranges that I told you about, the traditional medicine ranges of normal. Normal down here at 250. Normal at 900. These are disease processes that we see higher incidences of at these levels of testosterone in man. So at less than 900 testosterone, we see an increased incidence of Alzheimer's in men, and that's a high normal. When we have mid-range testosterone, we see more diabetes, more fatigue, more libido loss, heart disease. Mortality is death, and that's with a hormone, testosterone level in the mid-range of normal. So what we're looking at doing is optimizing to get you here and a little bit higher from man. For a woman, that reference level is lower, but it's still much higher than the reference range given by traditional medicine. So this is a list of positive effects with the use of human identical testosterone for men and women. And those symptoms include increased energy, improved feeling of overall well-being, improved memory, cognitive clarity, improved mood symptoms, focus, libido, performance in the gym. Guys will say, I'm struggling to run a mile, and I used to be able to marathon run. So we'll see increased performance after a few months with therapy. The other part of this is testosterone is absolutely necessary in organ function. So we see improved brain protection, heart protection, bone protection, prostate and breast protection, depending on male or female. Increased muscle strength, and over time reduced body fat and lower cholesterol. Menopause is what we hear about for women. 1.3 million women enter menopause yearly. Another thing that is not always told is that you might experience the symptoms of menopause 15 years before that period stops for a year. So if your menopause is the normal age of around 50, 51, in your mid-30s, you can start having symptoms of menopause, hot flashes, night sweats, low libido, vaginal dryness, you name it. And it's ignored, or you're prescribed birth control pills, or you're given antidepressants, or they blame it on 15 other things, and they tell you to get up and exercise or sleep more, and you're like, I can't do it. I'm doing all the things, and it's still not working. Many women don't get over it or get through it completely. So traditional medicine also says hormone replacement for 5 to 10 years, and then we have to stop it. Well, maybe you're not ready for it to be stopped yet. Maybe you feel awesome and you're not ready to quit. With the Biote method, we have pelleted 96-year-old people, and they're doing great, and they say, don't you dare take it away. So, yeah. This is really significant for heart disease in women. We know that as women age and go through that menopausal transition, that the risk for heart disease increases. It's because the protective effects of estrogen go away when it's diminished to next to nothing, and at that point testosterone's already gone, so we don't have the protective effects of testosterone either. Prior to menopause, it's a 1 in 7 risk, which is still too high in my opinion. After menopause, that jumps to 1 in 3 women will have a coronary event. So again, estrogen is present in both men and women. We don't look at these as pink and blue hormones anymore. We think of them as necessary for all people, okay? It has over 400 functions in the body. That lock and key system, this is necessary to unlock so many systems in the body. So we need it. It maintains bone density. Testosterone helps build bone. It helps maintain memory, manages collagen in your skin, and increases serotonin and dopamine, which are kind of those happy hormones, or those things that help us with mood. So some of the positive effects are reversing some of that. It can improve your memory, and then this prevention of neurodegenerative conditions, that's like Alzheimer's, just brain fog, memory loss, things like that. It starts early on, and so we want to nip it in the bud. We don't want you to get to the point where we're having to worry about Alzheimer's. We want to help your body prevent that development. So hormone therapy. Again, I was giving you guys a little bit of a rundown on how I was taught to do hormone replacement out of medical school. That included synthetic hormones like Prem-Pro. Premarin and Provera is what Prem-Pro has in it. So if you still had a uterus, you had to be on Prem-Pro because we needed to protect the uterus. We do. However, synthetic hormones are not good for us, and we'll get into that, I think, in a few slides later. But I want to talk about the differences between the synthetic and bioidentical. So synthetic things also include patches like Clemera, which we may still use in some women depending on finances and other situations, and then shots. We can do testosterone shots in men and women. Again, we'll show you a couple slides how that's not the most efficient way to replace hormones. Bioidentical replacement includes pills, patches, creams, gels, and pellets. Pills can also be called troches or troches, which is a dissolvable pill that you put between your cheek and gum, and that's what I have been using for my patients up until I started working with Biote. So the conventional hormone replacement methods. There was this women's health initiative that was resulted in 2002. I was a nurse at that point and remembered hearing about this. It was, I think, 25,000 nurses that they'd done a several year study with nurses reporting diet, supplements, medications, exercise, and they were studying mortality. And during that time, they saw an increase in stroke, heart attacks, breast cancer, twice the rate of blood clots, and a huge increase in Alzheimer's disease. So these were women that had been on birth control and had been put on standard hormone replacement therapy, Premarin. Okay, Premarin is from a pregnant mare. That's where they obtained that estrogen, from the mare's urine. So not human identical. And then the progesterone portion was not a bioidentical progesterone. It was progestin, which is a different chemical altogether, and that over time we've discovered that was the biggest part of the problem in this group, is that they were on synthetic hormones. So yeah, they had terrible outcomes, but there was a lot of other there was no control group. It wasn't studied an alternative, there wasn't the alternative comparison to show that all hormones were bad. Just this type of hormone was not great. All right, so patches. They're easy, they're convenient, they are fairly regular release. You just have to change it every week, so you get a little bit of a drop off on the hormones at the end of the week, and then you change it out, and then you're good. Problem is it might not stick to your skin. If you get sweaty, it might fall off, and it only works in women who have a BMI that's less than 27. So that doesn't work for a majority of women in this age group. Still is made with certain synthetics, and a lot of people won't absorb it consistently. So creams and gels. This is a little difficult. So generally when we prescribe hormone replacement with a topical cream, it's in a pump delivery system that is supposed to measure out the exact amount you need, and that can be 2 to 4 pumps. Well, that's like 4 teaspoons of hormone cream that you have to find a place on your belly, upper thighs, or underarms to rub it on. And the recurring complaint that I had is I feel like all I do is rub my body all day and it still doesn't absorb. And you have to apply it twice a day. And so it gets annoying, it can be dirty or feel grimy. Then you can't get it on other people. You don't want estrogen cream on your husband. You don't want your babies to be getting estrogen or testosterone cream on them. So we have to be really careful about washing, and then the towels that you use to dry your hands, you have to wash them, that they can't be used by the rest of the family, and it's a thing. So it's a lot of process. So injectable testosterone, a lot of men are on testosterone replacement with shots. And it's been an improvement for them, and it does lead to life satisfaction. But there's a lot of peaks and troughs in the treatment. It goes up and then crashes, and up and then crashes. And so instead of having this nice, consistent, level-headed, well-balanced approach, we have crashes, and that can happen every 3 to 5 days, because that's how quickly some men will metabolize the testosterone. And so it's variable, it's difficult to regulate. A lot of men will only get it every 2 weeks because their doctor doesn't know how to give it more often, or won't give it more often. And so we go through a week of feeling great, and then a week of feeling terrible, and then a week of feeling great, and a week of feeling terrible. And so it's what we have for a lot of people. The other part of it is it's synthetic, and so again, I don't love it. I use it when I have to, but I don't love it. It has to be excreted through the liver, and it can create some toxicity. It is associated with some instances of elevated cholesterol, because even though this is a clear syringe, it's a white product, and so it is a lipid carried molecule because it's a hormone. And so over time, if we're doing this for years, we might end up with some issues there. Okay. So the hormone pellets, they really are that tiny. So the Tic Tacs over there, if you want to take it for kind of a visual aid, that's what those are for. For men, that's about the size of the hormone pellet that you'll have, and you'll get several of those placed based on what your testosterone levels are. Women get testosterone, but they're smaller than that even. So basically, if you had sucked the coating off, that's about how big the pellet is for women. So it's, like I said, a good visual over there. It's natural, it's a plant-derived compound, same molecular structure as human hormones, so that key fits the lock. It doesn't have to be kind of, it fits and we're gonna jimmy it a little bit. It actually fits the lock. Most patients, the Biote practitioners, will see that the pellets last 4 to 6 months. Women get fewer milligrams of testosterone, so they tend to get 3 to 4 months out of their each session of pellets, sometimes a little bit longer depending on how fast your metabolism is. Men typically will only need 2 pelleting sessions a year on average. So about every 5 to 6 months, men will get their repelleting. We work at about a 20-week repellet rate, just to make sure we're not letting you go too long without it. And again, our replacement frequency is based on your symptoms. So if you're at 16 weeks and you're a man and you're like, I've burned through everything, I'm exhausted, I can't, I feel like I did before, then we might pellet a little bit earlier. Same with women, instead of waiting to that 14 or 15 week mark, we might go to 12 weeks. So it just depends on you, okay? It's individualized dosing. You're good, you're good. Individualized dosing, we used over 200 different data points to calculate what your dosing should be for each hormone, for thyroid, and recommendations for supplements. So it is personalized. Pellets have been around a long time. A lot of people are just hearing about them for the first time because it hasn't been commonly used. It's been used in Europe for decades and decades. In the US, it was used in post-menopausal or radical hysterectomy patient females. So 1939 is when they first started using the estrogen pellets, just to have it, because it's been used in animals longer than that. In 1949, they also talked about estradiol and testosterone pellets for symptoms of menopause. And so we have a bibliography of many, many different research studies showing how effective it is and how safe it is. This is the graph that I was talking about, where it kind of shows the ups and downs, the peaks and valleys of hormone replacement therapy. So levels of estradiol in days, it's not given a number of days, but you take a pill, you take it and it drops off. You take it the next day and it drops off. You take it and it falls off. So then there's the patch. You take it and it's good for about 5 of the 7 days you wear the patch, and then it starts to wane, and then you put another patch on, and then it starts over. And then with the implants, you have a nice steady level. And some people have argued, well, your body isn't consistent levels all the time. It has to change and fluctuate. Well, you'll still get some of your natural fluctuation, but this way the administration of your replacement is consistent, so you aren't having to worry about your next dose. So what is the Biote method of pellet therapy? Like we've already talked about, we want to get the body back to a normal hormone balance. We don't want to go so far out of whack that we're creating symptoms. So it's a conservative approach. We use human identical hormones. We use the individual dosing, and we place the subcutaneous hormone pellets, and those are in your butt cheek. and we can talk about the procedure if and when you're ready. So this is, more information on the studies. This company has done more placements of pellets than any other company, probably by, I think, what do they say, millions to tens of thousands in comparison. So there are so many people with so many data points, and they are safe. They are easier to do consistently because you only have to do it a few times a year. You don't have to remember it every day. You don't have to remember it every week. You don't have to remember a shot every month or two, or every other week, or every week, depending on who you are. So it also doesn't require needles. If we're doing hormone injections, those you have to inject yourself, every week or two. Minimal side effects related to this, and if you do have side effects, we handle that through natural supplements and recommendations of exercise. So we can't remove it, but we have ways to help manage if we do feel like your body feels like you're getting too much. Typically, that's not usually the problem. We end up adjusting dose with the second pelleting, or people are like, I feel great, don't change it, I want to keep going. Breast health is something that comes up frequently, especially with hormone replacement therapy. Women who've had breast cancer or breast cancer in their family are often told they can never have hormone replacement therapy ever in their life, and they suffer and suffer and suffer with menopausal symptoms, hot flashes, night sweats, mood changes, low libido, vaginal dryness, you name it. One of the things that really drove this home for me is some of the research that drove the use of the pellets in the United States was in a breast cancer study where they actually treated advanced breast cancer with testosterone pellets. And what got the surgeon interested in further study in how to use this in the women is that the patients that received the testosterone pellets for the treatment of breast cancer, it was high dose testosterone at that time. They felt so good, they said, my cancer's gone, but can I keep having the pellets? Because I feel great. And they did so much better than their cohorts that didn't receive these with treatment with chemo and all of that. So testosterone on its own does not increase the risk of breast cancer, unlike the oral synthetic methyl testosterone, which is, again, what is used in the troches that I don't love. So I prefer safer. I prefer less side effects. I prefer protective supplements for my patients. Testosterone implants have shown less stimulation of breast tissue, so we get less of the breast swelling and lumps and bumps like we would with traditional hormone replacement with estradiol and just progesterone by itself. And there's another slide that will pop up here. Treatment with testosterone and estradiol implants do not increase risk of breast cancer, even in breast cancer survivors. And estrogen alone does not increase the risk of breast cancer. It's when it was combined with that progestin, the Provera, that we saw that increase in cancer. So this is another study that was done in the Journal of the National Cancer Institute. So it was a study of 2,700 women aged 35 to 74, and they measured breast cancer recurrence on those that are receiving the bioidentical testosterone versus no hormone replacement therapy. And the recurrence was 17 out of 1,000 in the users on hormone replacement therapy, but 30 per 1,000 in the ones that were not on therapy. And then mortality rates, so that's death from the breast cancer, it was 5 out of 1,000 in the hormone replacement therapy users, but 15 out of 1,000 in the non-users. And then total mortality rates were 16 per 1,000 person years in the hormone replacement therapy versus 30 per 1,000 person years in non-hormone replacement therapy. So it's cut in half, that mortality rate with the use. So it is safe. We do monitor it, and we do have the ability to use anastrozole, which is kind of an anti-estrogen, with it if we see women converting that testosterone into estrogen in the body, which in some folks with cancers we don't want. So we do have ways to manage that while they still get the benefit of the testosterone. So bone health, I know that has come up already. So it's a bone builder. It doesn't break down the bone. The lack of hormones actually allows the body to break down the bones faster. So we want to improve that. 4-fold increase in bone density over oral estrogen and 2.5 times greater than the patch estrogen. So we grow 8.3% for testosterone therapy with the pellets, you know, that improves bone density by 8.3% versus 3.5% for patches, or only 1 to 2% for oral estrogen. And so I think that's fairly significant evidence there that that's helpful. Arthritis. A lot of people don't believe that bone and joint pain can be related to your hormones, but the lack of it allows those to kind of get dry and worn out. And so when we have the right amount of hormones in our body, we can lubricate and we can stay mobile and we can repair that bone that's getting damaged with arthritis. And so we end up having a lot more pain relief. Brain health. This is huge. So women get Alzheimer's disease 8 to 1 over men. Men have testosterone. Women lack testosterone, and it starts very early. So where are my keys? Where did I put my sunglasses? They're on your forehead. What's the thing called that you put the clothes in and wash? I'm 45. I've started doing that. I'm not okay with that. So I'm doing everything in my power to improve my ability to keep my mind and my memory. So men with low testosterone are 3 times more likely to develop Alzheimer's than men who have a normal high testosterone level. Heart health. A lot of people ask about that. Well, are I at a higher risk of having a heart attack if I'm on this, or higher risk of blood clots, vascular disease? Actually, no. This actually is protective, helps improve your blood pressure and cholesterol over time. And so we have a timeline, if you guys are interested in looking at it in the other room, but it shows, you know, more immediate effects within weeks to months with the hormone pellet replacement. Those are usually your libido, your stamina, endurance, improvement in erectile dysfunction for men. Those happen in the first weeks to months of having pellet placement. Muscle mass improvement happens like 6 to 12 months after placement, but we start seeing improvement in bone health, heart health, which is lower blood pressure, improved cholesterol between the placement and about 2 to 3 years after you've been on hormone replacement therapy, and that's exclusive of any other changes. So that's what they found, adding to just the normal, regular, routine management of those diseases, it starts to improve over time. So yeah, we talked about men, hormones in the heart. So there's marked reduction in fat and improved lean body mass. So instead of being soft and pudgy as we age, we'll retain some of that lean muscle mass. So that helps with weight management, it helps with strength, it helps with stability. So decreased, this is me saying this, but decreased falls occur when you have higher muscle mass. So you have improved balance because you're stronger. So some key takeaways from tonight's talk. Hormone imbalance can occur in men and women at any age. HRT is a cornucopia of therapies, so you want to know the differences, and that's why we talked about the different replacement methods: patches, pills, troches, pellets, injections, synthetic versus bioidentical. So there's lots out there, so lots of questions to ask, and that's not wrong to ask those questions. It's not one size fits all, so you can't say here's this and it's going to work in every person. And so that's why I like this, because it's an individualized approach. The low normal labs, you're good. Sorry. The low normal labs have been considered normal by traditional medicine doctors for years and years and years and years and years. And I have even learned recently that my more generous functional medicine ranges could be better. And so we work to optimize your health. We work to optimize those levels. And we don't treat just the labs, we treat how you feel. So we take that into consideration too when we continue to adjust things if needed. So, any questions? Yes, sir.
So, I understand the creams and the patches and kind of that what you described there, but the convenience of a pellet is because you don't have to do it all the time, right?
Yes.
Versus taking the pill every day.
Yes.
And so you get something the size of a tic, just so I can understand.
Sure.
Like a Tic Tac size injected in you, and is that it all dissolves?
Yes. So the question is to give a little more detail about what the pellets are versus the creams, injectables, and pills. So the pellets are small, little cylindrical objects. They do dissolve in the body over time. Most men don't just get one. So it's not just one little thing that's going to dissolve. Women, it's usually 1 or 2 small pellets. Men will get anywhere from 8 to 12. Okay, so when we do the procedure, you're numbed up well. We have a sterile technique that we use, and we place them in kind of a little patterned field, so that they have room to get blood flow and absorption. And what creates the speed at which they're absorbed is your cardiac output. So if you're an exerciser, if you're a marathon runner, you're gonna burn through them a lot faster than somebody who sits on the couch and just watches sports. Okay, so doers or watchers, it makes a difference. Another thing that can impact the speed with which they're absorbed is cigarette smokers will absorb them faster. I don't like to use estradiol in anybody who smokes, so they can have testosterone, but not estradiol. So if you want estradiol and you need estradiol, you have to quit smoking for me. And men don't get estrogen. Men only get testosterone. Women can get testosterone and estradiol. And if they have a uterus, they have to be on progesterone to protect that lining, to prevent any risk of overgrowth of that uterine lining. But does that answer your question?
It does. And so is this something where you should probably get like your PCM to talk to you to make sure, like if you're on some other medicine, that you're all, that it's okay?
So if you have your list of medication, since I am a physician, I can look at it and know if it's safe or not. A lot of times what is going to happen, you're going to go to a regular medical doctor and they're going to go like, oh, that's like, you know, don't do it. You're drinking the Kool-Aid. It's not, it's just, you're just going to pee it out. That's the answer. You're just going to pee it out. Or you're going to like grow a horn. Okay. So yeah, so I'm fully comfortable at looking at interactions and any other meds you're on. Yes, ma'am.
Excuse me. I had a hysterectomy about 8 years ago.
Yes.
If I was to do this, would it take longer for me to feel the effect than a
No.
person? Okay.
No, because these hormones are going to act on the end organs that we need the hormones to work on. You don't have to have a uterus for it to work. Okay. Even if you don't have ovaries, you don't need ovaries for it to work. When they're injected, they get into your bloodstream, and the bloodstream carries it just like it was a naturally made hormone. It carries it to those tissues and organs that need treatment or need the hormone. Yes, ma'am.
So does this delay the onset of menopause, or what happens then?
Sure. So when you are in the perimenopausal range, so what defines menopause is 1 year without periods. Okay? So depending on how close you are to menopause and depending on how sensitive to hormones your cycle is, it can potentially make it look like you're entering menopause. It won't necessarily delay it. So it's not going to keep you fertile longer, okay? It's not going to put you into menopause earlier. So you're still going to follow your physiologic pattern.
Okay.
Okay?
Okay, that was the
Yeah.
question.
Yeah.
So like if I was normally without the Biote, say I was gonna go through menopause at 52, it wouldn't delay it to like 62 then
No.
or anything like that? Okay,
No, so the
okay.
only thing that it does is create the change in your symptoms. So what we watch for
Okay.
menopause in women is your FSH. So the hormone from your brain that tells your ovaries to create your hormones. That's how we know you're in menopause, okay? And so when we see that change, when we do your annual blood work, that's it when we know if menopause is what's going on versus something else, okay? And with this replacement, if you're still having periods, we don't put estradiol in. We just use testosterone. So the estrogen's not there to create the alteration in your period because your body's already making it, because if you're still cycling, you're already making it.
Okay.
So what we do is balance the testosterone, and I personally, as a provider, like to balance your estrogen progesterone because there is such a thing as estrogen dominance, but we usually use this supplement called DIM. DIM is the only non-negotiable supplement that you have to take if you get treated with hormones here, because we want those hormones to be maintained. It's protecting your investment so your body's not converting it too fast to the estrogen or secreting it from the body. And it also helps make sure that those hormones are going down the healthy pathway, not going into the recycle, multiplicity. We don't want the side effect hormones, okay? So DIM helps us keep those copacetic, happy, healthy. Okay, any other questions? Yeah.
Maybe a couple slides back and talk about thyroid stuff.
Mhm.
So, if you're on thyroid medicine, do you stop taking thyroid medicine, or does this kind of
So
supplement
the
that first?
thyroid, so basically our approach is making sure you're optimized. So we use the desiccated thyroid. we try to get folks on the T3, T4 products like NP thyroid, Armour thyroid, or what works, okay? And so this isn't going to reduce your need for your thyroid medicine, but it helps us get you in the optimal range because it will calculate out if you're suboptimally managed. Did you have another question?
I did, but that's part of my problem, memory.
Okay. Fair.
Sounds like you're in the right place.
So with the pellet being under the skin, is there
Yes.
any issue of touching that area by your spouse?
No.
So
So
that
it is
stays-
deep enough under the skin. It's not right under the skin. So we go underneath the subcutaneous layer into the plane between the muscle and the fat. So it's very deep, but not like deep, if that makes any sense. Okay? It does not get onto your skin. It's not going to spread. It's not going to do any of that. Women have a 3-day gluteal rest period. Men have a 7-day gluteal rest period. That means no intense working out, or stair climbing, running, lifting during those 3 or 7 days. If you're already on hormone replacement, women would take it for 3 days and then stop it. Men, if you're on an injectable, you take your shot, get the pellets, and then you're good to go.
Can you see the pellets underneath?
You can't really see them. However, men, because of the bulk, the number of them, they may have kind of a little raised area while they're being absorbed. So you're not going to see the individual pellets, but you might see just a swollen area. Tenderness is minimal for most people. It feels kind of like you ran your hip into a doorknob for a few days, and then that's gone. We numb it up with a long-acting anesthetic that lasts most of the day. I'd say probably 4 to 6 hours, depending again on your metabolism. So you have an ice pack, we send you out with that, and you're good to go. Okay. Anything else?
If you have any major allergies,
Mhm.
say eggs or
Yes.
proteins, would that have any effect on?
So, as far as we know, because we've had a few people ask, as far as we know, there's not any major allergens in the product. If you had multiple, a long list of allergens, what I would do is have you talk to the manufacturer to see if they can tell you if any of what they have would interfere with your allergies. Okay. All right. Anything else? Yes.
If you have migraines due to hormones,
Mhm.
what will this do?
So we actually regulate or modify the dose of estrogen for women. And we also, in some women, if they have hormonal headaches, we give a tiny amount of estradiol prior to menopause because we want to keep the estrogen level instead of up and down. So it just depends. So we that is a trial process. Once it's in, we can't take it out. It is a very small dose. And so some people opt to continue with it, and some people say it didn't help, so I'm not going to have it next time. But yeah, we do modify the dosing on hormonal headaches. Yeah.
And could you go over again because you stated
Mhm.
it's if something's happening that you can't take it out.
Right.
What is the
How do we fix that?
how you fix it?
Okay, so it depends on what the problem is, okay? So these are all problems I've heard, okay? And this is anecdotally, from our education and then some things that I've seen around here. So the one that we kind of snicker at is my libido's too high. All I can do is think about sex. That's a problem. For some people it's a problem. Is it a problem? It can be a problem. So at that point, what we do is we might let you burn that testosterone a little bit. So I might have you stop the DIM for a couple days or reduce your DIM for a few days just to let your body burn it up a little bit faster. And again, your spouse might not think it's a problem. Maybe they will, I don't know. So that's one common problem, okay? Common, not everybody gets that, but it's one I've heard more than once, okay? Women, especially, when we take you from having a testosterone level of 3 or less up to 150 to 200, and occasionally we'll hit 300 just because your body's so excited it's taking it all in. You might have a period of time during the transition of using the hormones that you get a little bit more acne on your face. That goes away when you hit your peak, which is great because it's just telling us your body's starting to convert and then it goes away. So I think week 3, I noticed a few more pimples than I'd had in a while. And once my body leveled out, it was great. There's a little bit, tiny increase sometimes in, like if you have a few chin hairs that you don't want, they might be a little bit thicker. I can think of a lot of other things to trade. Other symptoms of, excess. There's really not a lot of excess issues. We don't see hardly any complaints or concerns. But those are the two that I see most commonly. Now, when we go to do your second round of pellets, if that symptom is persistent, if it continues, then we reduce your next round so that you don't get as much, because we want you to feel good, okay? In a small percentage of people, they will have weight gain because they're like, hey, I want to lose weight. You said I was losing weight. Well, remember the timeline. Timeline is actually 1 to 2 years that you're going to start seeing that really significant change in muscle mass, where your body has enough muscle mass to start burning the fat, okay? You still have to exercise, you still have to eat right, you still have to take care of your body. The pellets are not going to do all the work. You can't just sit there and do nothing, okay? But that initial weight gain in a certain percent of the people is because, again, your body's like, it hasn't had hormones, and then it gets a lot for it in comparison from what it's used to. So it makes some edema. So that swelling is usually the weight gain that you have. It's water weight. And so for that first month, we might have to give you a little bit of a water pill to help your body clear that out, because it's just so excited. It's making all of this stuff and doing all of these things and having all of these byproducts and changes, and I'm working again. But you get a little puffy. That happened to me. I didn't take any of the meds because I don't like to take pills. I'm doing good to take my supplements. So
And aside from Regan, we've done 40 plus.
yeah.
We've prescribed that medicine once.
Yeah. So it's not.
It's not that common.
Yeah. So.
But it can happen.
So what if, for whatever reason, I would have to stop?
Mhm.
What are some of the repercussions? Would I all of a sudden crash and burn
Well,
out?
once it's worn off,
Mhm.
you'll probably be back the way you were.
But not
Okay.
worse.
Well, hopefully not worse. You start to deteriorate again,
Yeah.
right? So that's where we still want you to do all of the right things with lifestyle, diet, exercise, so that you can be strong and build those muscles so that they can still be strong, okay? We did actually see a gentleman when we were in one of our training sessions, law enforcement guy, who had done pellets for a couple years, and he's like, I just got tired of spending the money. Didn't want to waste the money on it. He says, I've been without him for a year, and my daughter said, Dad, I'll pay him for him. Go back and get your pellets. You know, it's a thing. So, and he said, within about 3 months after I was due, he said, I was moody, I was irritable, I was weak. He's in law enforcement. He says, I can't be weak. He used some other choice words because, law enforcement. But, he says, I'm back, doc. I'm not going to quit again. And so it does make a difference. And then the folks that really it works for, they stick with it. And, the other thing we were talking about for men, when they have their first set of pellets, sometimes their estradiol goes up. Okay, men have estrogen, women have estrogen. Men have testosterone, women have testosterone. The DIM helps us regulate that estradiol level in men. We don't want it too high because men can have breast growth and a little bit of mood changes if they get a little too feminine in their hormones, okay? If that starts to happen, or if your estradiol goes up significantly, we increase the amount of DIM that you're on to help your body excrete that. And so that's, again, something we have at our fingertips that we can do for you to help with that if that does happen. So, yeah. Anything else? Any other questions?
Do you wanna speak about the boost?
If it's needed, not really. Does anybody that's had pellets want to share their experience with pellets?
Sure.
Do that.
Come onto the camera, or at least close enough to be heard. You can sit under it if you want.
No, I'm good here.
Okay.
So yes, we all got the pellets at the same time. We all got our second round we did ours at 12 weeks because, generally what we're seeing with women, this first round, either you're gonna feel a whole bunch of stuff or kind of. So I was in the kind of range, kind of went along that, I don't know, it was probably after about 2 weeks, I thought that I was feeling a little bit more, but I wasn't doing anything better for my body than what I was doing before. I was still eating things that I wasn't really supposed to eat, wasn't exercising, any of those things. After the second round, there's been a significant difference. I don't need a nap in the afternoon on the weekends. I can choose to take one, but I don't need it. I mean, there's the copious amounts of caffeine, like Dr. Seacrest had said, you don't have a caffeine deficiency, you have a hormone deficiency. So that caffeine, your body does not need it to function unless you have something that's going on with your hormones that's making you tired every day. So I like coffee, so I drink coffee in the morning, but I don't need it. Same thing in the afternoon. I was drinking a Monster to get through to 5 o'clock so I could go home and maybe make dinner, and that wasn't happening a lot. So my girls are becoming good cooks. Anyway, so yes, I'm definitely one that, I've had a lot of different traumas in my life, and depression has taken over, but with, the things that I'm doing for that side, and now that my brain is happier, I can face things a lot easier. Just if things come up, it doesn't affect me as much because my mood is increased, my energy's increased, because I think we all know how we feel when we're tired and hungry. And that's the other thing, I don't feel like I need to eat all day either, because I have that level of energy that is, it's sufficient for me. And so my next step is, working more to get, to exercising more. And because I feel like, what I'm doing food-wise is, starting to work. And so, yeah, that's my experience.
Yeah. We had hoped to have a couple of men here that could give us a little testimonial, but they had to travel, unfortunately. So I just want to share some of the excitement that they've had. You think he'd mind if I shared a little bit more? Maybe if I don't say names. How about I keep it nameless? Sure. But one patient came in, gung-ho, wants the hormones. Haven't seen a doc in years. Doc, take care of me. Tell me what I need to do. Drew his blood and it looked like milk. Cholesterol was so high that we couldn't even get his full cholesterol numbers. So in addition to hormone replacement therapy for his energy, for his stamina, for his strength, for his brain, for his heart, for all of these things, put him on a Pritikin diet, which is a restricted vegan diet, as well as medication to control his blood pressure and a little bit of medicine for his cholesterol. And 4 weeks later, we did his labs and we could measure all of his cholesterol levels, which means they came down significantly. The hormones went from 200 to 1500 on his testosterone, feeling great, exercising, more energy than he and his wife know what to do with, and they are just thrilled to pieces. And if you looked at him, you'd think he's in great shape because, he has muscle, he looks fit, but that's always the exterior. Yeah. So we're working on that internal health as well.
Triglycerides went down, we're as high as 1600. We were very concerned about it.
Yeah.
Obviously seeing milk as we drew his blood. But within 4 weeks, it was down to 363.
Yeah, which is still high, but
He did initiate
a quarter of what
his
they were.
diet, though.
Yeah.
I mean, it's not, testosterone can't do that, but he was, very, good about he was determined.
He's an example of doing all of the things, that we asked, the supplements, the lifestyle, the diet, all of that. So it's a good thing. I had shared previously, my dad had great results with his first round. He's coming due for his next set of pellets. He's feeling it a little earlier than the 20 weeks. It's about time for him to have it, probably a little early because energy is declining, things like that. But his energy increased, his muscle tone increased. He was able to walk and do his workouts. He had lost 25 pounds. He was doing fantastic. And so we're at that 15 to 18 weeks. So it's about time to get them in for him again. Yes. So I think that's it. I'm gonna go ahead and stop the video.